In this video, we're going to be showing you how we work with intrapelvic torsions using AIM wedges. So, first I'm going to assess Jessie to determine whether she has an intrapelvic torsion. And there's many ways to do that, but this is our preferred way, is I'm going to have one hand on her ASIS and one finger on her PSIS. There, good. And then I'm going to have Jessie sidestep away from me laterally so I can just see the slope of my fingers. Okay, super scientific. But we're going to compare with the other side. So on her left side, PSIS, ASIS, let me just make sure. Okay, good. She's going to step away and out of the view of the camera. And as you can see, there's a significantly greater slope. So we would call her left anterior. So we're going to talk about how to address that. So in AIM speak, that means that her pelvis is stuck in left suspension phase, where the left side of the pelvis is more anterior and the right is more posterior. So we're going to help her pelvis experience the opposite. So I'm going to have her be sitting on a wobble board. And we're going to use our nice little AIM wedges. And so I'm going to have her sit facing the camera, so this will be her left side. And I want to encourage the left side, or I want to block that anterior tilt. So I want to encourage more of a posterior tilt on the left. So if you imagine her facing that way, you can see how this would rock her back or into a posterior tilt on the left. And then just the opposite on the right. So I'm going to have her sit on this wobble board that allows us to visit all three planes of motion while blocking her pelvis from the direction that it likes to live in. So she's going to sit with her sit bones on the wedges, and I'm going to be first passively bringing her pelvis into all of the planes of motions that it wants to visit for right suspension, or the opposite side that she doesn't like to visit. So this is completely passive at first on her part. I'm going to bring her into an anterior tilt. So I'm tilting the board forward, and the wedge is blocking the left side from going as far as the right. And then I'm going to, maintaining that anterior tilt, I'm going to bring her into a right hike. And normally I would have her a little bit in front of a mirror, so to make sure that the rib cage is still. And then maintaining all of those, I'm now going to bring her into a left rotation in just the pelvis. So that's a lot going on in her body. She's going, whoa, what's going on? Someplace she's not used to visiting. So again, I'm going to bring her to the same place, but I'm going to come in using different planes. So this time I'm going to start with the frontal plane. I'm going to hike on the right. I'm going to rotate left. There is no right or wrong. We're just getting her into the same place in different planes. Rotate the pelvis to the left, and then bring her into her anterior tilt. And we'll come out of that, and we'll just do, this time starting with the transverse plane. There's no right or wrong. We're just adding, and we're starting with different planes. So we're going to bring her into the transverse plane first, and then the hike, and then the anterior tilt. So I would sort of play with different arrangements or combinations. But now I'm going to cue her to bring her own pelvis into those motions. So, yeah, she will adjust her wedge as needed. Yeah. And then I think also you might need to, are you centered on the wobble board to start?
I don't know.
Okay.
Oh, there
All
we
right.
go.
All right. So, Jessie, I'm going to have you first anteriorly tilt the pelvis. Then I'm going to have you rotate your pelvis to the left. And I'm going to have you keep the rotation, keep the anterior tilt, and hike the right or drop the left. Good. And then come back to center. Okay. Now we're going to hike right to start. Hike the pelvis to the right. So tip the wobble board to the left. Let's start over on that one. Let's see you just weight your left sit bone. So more of a tip, like a seesaw. Yeah, and less of a shift. Yeah. And then rotate to the left. And then anteriorly tilt. Beautiful. And let's do one more. Let's have her start with an anterior tilt this time. And then a hike right. And then a rotation left. Good. So her pelvis is experiencing movements that it hasn't visited in a long time. We'll do one final one. Let's start with a hike right and an anterior tilt and a rotation left. So I'm just playing with the order. There is no right or wrong. Beautiful. And then let's just quickly reassess her pelvis, and no guarantees, no promises, but hopefully we will see some change, and her brain has experienced positions and movements it hasn't experienced in a long time. So, ASIS, PSIS, right there, side step away from me, please. Good, so that's the right side, and let's compare to the left. PSIS, I can already tell. ASIS, and step away so that the camera can see you, and you can see now she's more even. And you can hit stop.